up here we don't really have power all the while reliable. So I couldn't even have like vaccines here because sometimes the fridge wasn't working over the weekend, so I had to throw away all my vaccine. Now with the solar, I don't have to worry anymore.
Purpose here today is to acknowledge and to thank the Heart Foundation and Sister Berger for the wonderful work they do in the community here on providing health services on a very good level. The people come from far away, 30 kilometers around to this place. I even learned today they come from Kingston because the service and the people-mindedness bring them up here. So that is great. The German embassy had the privilege to be associated to this endeavor over 2 years now. We did last year the roofing from this building, and this year around we helped with the solar installation to bring electricity to this house. And also a lot of this furniture you see here is from the embassy. So we are a partner with Heart Foundation and with Nurse Berger, and we are very happy to be a partner in this very positive and fruitful work here for the community.
So today it was about the solar panels.
Today it was the solar panel, yes.
How many did you donate to this institution?
Just 1.5 million German dollars for that installation.
In your view, what do you think it will do for the clinic?
For the clinic, it brings electricity for free, so it will be an efficient reduction in the costing of running the clinic.
My name is Joanna Berger. I am German citizen, but I live in Jamaica now since 2018 again. I'm married to a Jamaican for 32 years this year. So I have a long relationship with Jamaica. I was even living here, we were living here with our children 96 to 2000. So, and since we are married, we're coming to Jamaica all the while. But we decide now to live out here.
Thank you for that background information. So tell me now, you have been head of this clinic for a while.
Yes, since August 2020.
Mm-hmm. How beneficial is the gift that you received today to this institution?
I can't even put it in words because it really did a big improvement to the situation here. The refurbishing was the first step, and now the solar energy, because up here we don't really have power all the while reliable. So I couldn't even have like vaccines here because sometimes the fridge wasn't working over the weekend, so I had to throw away all my vaccine. Now with the solar, I don't have to worry anymore. There's always electricity in the house, so we have really a good amount of times we have power cut up here, and then it takes sometimes a day or two before somebody come and fix it back. So that was my main concern. That's why I said I really need solar and to bring down the cost, because this is an area where people don't really have so much money to pay for the services. So I try to keep the cost as low as possible. But my salary cost, the energy cost. So this is one part of stepping down from the high cost and really make things a little
Can you tell
easier.
us on average how many patients you'll see on a daily basis and the environment from which they come?
Okay,
or the localities from which they come?
it's round about 30 kilometers around. Like we have people here from retirement, from Barnet, from Arcazal, from Glengarve, from Golden River, from Zion Hill, a lot of places. And everybody is traveling to here because they know they can get affordable service. I even have a little pharmacy with over-counter sales, and when the doctor is in, I have also prescribed medication on that day. So, and even that, I keep the cost very low for the people so that they can afford it.
What are the services you provide?
My services are, it's a whole range. I do the regular thing like blood sugar, blood pressure, hemoglobin and cholesterol, the prick test. I do pap smear, I do ECGs, I do medical pedicure, I do wound care. I have a special connection to the school, so the school children come up here. I do vaccination, all kind of things. I do a lot of things here.
The last time when the expansion was done, I think the Germans were behind it also.
Yes.
I know
yes.
you suggested that there was not a dental
Yes, that is my next project. I would like to have, I get 3 dental chairs donated from people in Germany. Right now they are still in Germany at a safe place, and x-ray machines also for dentals. So I have to leave and go to Germany to get a container packed and food for the poor, and the German embassy. I would like them to do a joint project on the dental chairs. And that would be further on, later on in this year.
What assistance you get from the Ministry of Health?
Well, it's a non-government.
This is a non-government clinic. So what I do, I have a good relationship still, like we're doing the food handlers, so they come here and do their food handlers. So I have a relationship, but I don't get no support from the government.
What is your staff complement?
Me one alone. And I have a lady now, Miss Carol Creary, she's out there as well. She is more like helping me on Doctor's Day. She's pulling files, and when somebody comes inside and I'm registration, she asks, what can I do for you? And she pulls the files and she's helping me. But the service alone, the nurse service is just me alone.
And doctors?
And the doctor once a week. Dr. Da Costa comes every Wednesday from 8 to 2. Also for a very reasonable price. She's looking after patients, and we see between 20 and 30 patients every Wednesday.
The Heart Foundation of Jamaica are the administrators for the clinic. There was a close connection between the founder of the clinic, who was Nurse Ryman, and Mr. Peter Bangato, who was the founder of the Heart Foundation of Jamaica, who was the Swiss consul at the time. And he was concerned that in terms of sustainability of the clinic needed a structure. So the Heart Foundation board agreed, we're a charity ourselves, a non-government organization, to take over the administration of the clinic. So we work very closely with Nurse Berger now, help her with whatever she supplies, she needs. She orders her materials to the Heart Foundation, any advice that she needs. So our full management team helps to run the clinic with Nurse Berger.